Hello everybody, welcome to part 5, Evaluating Creativity and Course Synthesis. This will be a short screencast lasting only about 5 minutes, and I look to take you through the last part of our Continuing Professional Development module on creativity in the health professions education. So, for today, what I'm going to do is a quick final lesson. There will be no reading. We're going to work towards creating an assessment or an evaluation tool in creativity. I'm going to show you an example document that I've made. I'm going to assign 2 final assignments to get the full credit for the module, and then wrap up with some final thoughts and ideas. So first, I'm going to have you look at a video here. This is an older video of a famous Canadian figure skater. And I'd like you to look at this video, and when you'll see in the pop-ups, it will prompt you what I want you to think. But within the video, what you're going to think about is, how do I go about evaluating creativity? Something that seems very difficult, much harder than a multiple choice test, testing some sort of scientific concept. Okay, so once again, you can pause this video, go ahead, watch the link through your PowerPoint presentation on Edmodo, and then come back here and we'll take it from there. Okay, so let's talk a little bit about creating assessment or evaluation tools. So this is a very necessary component, and it's necessary because it validates creativity's role. So if you come out of this acknowledging creativity, but you have no way of testing or assessing or integrating it into your classroom, then I won't have done you the full service of conveying how you can use creativity to improve clinical competencies within medical or health professions education. It can take shape in a variety of ways. So because we're assessing creativity, why can't we be creative in doing so? It is difficult, however, to conceive of how I go about doing this for something that's creative. So we can make charts, we can do rubrics, or we can make scales. When I want you to think back to Lecture 2 when we talked about fluency, flexibility, originality, and elaboration, and we can think about those as criteria. They're quite reasonable, in fact, to think about them as criteria for assessing creativity. So what I have next is, this is an example document that I made based on my personal exciting creative application in patient assessments. So I should throw the disclaimer out that I have used assessment in the context of education as well as in the context of assessing a patient. So I hope there's been no confusion there. This is a creative assessment rating scale, and I mean assessment in assessing a patient in terms of a medical assessment. Okay, so as we spoke of in the last lecture, I feel that assessment can be carried out in a variety of creative ways. And I've just put a scale up here, just a simple Likert scale, where you rate from 1 to 5, 1 being none and 5 being exceptional, originality of an approach, different ways of asking the same question, different styles of question asked. Do they build sequentially on the questions that they've asked? This is a very important component. If you've asked someone if they've had chest pain, you want to further elucidate the nature of this chest pain, not just ask a different question. And then finally, are they contextually appropriate questions? Do they make sense with regard to the patient's context, the patient's history, their story, their previous medical conditions? So I hope this guides you in what I'm looking for, because my next point is to assign to you the task of creating an assessment instrument for a creative aspect of your health profession's practice. So that's assignment 1. Assignment 2 is much larger, and it's to conclude or to wrap up the whole class. So I would like you to create a creative handout or poster that could be given to a fellow colleague to tell them about your experience here and to convey to them what you learned, or a poster that could be placed on a workplace bulletin. Okay, so to wrap up our whole module, thank you very much for having gone through this with me. I hope you enjoyed it as much as I did. My lasting notes are that creativity is a needed aspect of health professional competency. I believe that creativity underlies many traits that makes practitioners successful. I think that it is important to train and to, importantly, select creative individuals for our programs. This makes them able to be innovative, as we talked about with discoveries such as insulin, and able to problem solve and manage interpersonal conflict within the work setting. Okay, I hope the assignments go well. As always, I can be contacted on the Edmodo website or through email if there's any issues. Thank you very much. Signing off. Bye for now.